sanitizing my hands. Hello, my name is Pratik Chacha and I'm the student for United FNP student for United States University. Today I will be making the mock exam for head to toe. I have already obtained a verbal consent from my patient, obtained a written consent from my patient, and will be uploading in D2L before I upload this video. And can I also get a verbal consent from you to make this video today and upload it in the YouTube as on listed, please?
Yes.
Thank you. Can I get your name and date of birth?
Shorthand 8/29/1990.
Okay, thank you, Vishal. And do you have any concerns for today's visit? Okay, just to let you know, if we find any abnormalities during today's visit or anything abnormal than the usual thing, I will not be treating you today over here. This is just a mock exam for the university. So if anything abnormality or anything concerning things are found, you still have to go to your recipe or nearest clinic to treat those, okay? So before we start the video, I would like to do the integrity check. So then we'll start the video. For the integrity check, like the first step, my ear, there is nothing on my ear, and again nothing on the ear. And for the watch, I just have a timer on my watch. Then I will be swinging with my iPad everywhere. So over here I have a table where I have all the equipments I need, and I have one white seat. This is just a white dump seat for my brain dump. Nothing is written. This is front. Again, this is back. Nothing there. And over here I'll be doing just a 360 scan. That is just the mirror there. Nothing is there. The room, living room. Nothing in my sitting chair. Nothing on the back of my sitting chair. Sorry, drop the paper here. Okay, so that is that. He's sitting over there, just the couch. Nothing on the wall. Just my Christmas tree. Nothing on the floor. Nothing there. And nothing there. Okay. So over here, this is the chair where I'll be putting my iPad. There is nothing in the front. There is nothing on the back of the chair. Okay, and then I'll be keeping the iPad like this here. And let's do the mirror check. For the mirror check, there's nothing here. There is nothing on the side. Nothing on the side anywhere. There. And here. Visible there. Here. Nothing on that side. There. Okay. Okay, I will adjust my camera one more time. Over there. Can you stand for a second so I can see if I can see your full body? Okay. Thank you. Go ahead and have a seat. Okay. So before starting a video, I will be writing something on my paper, just a brain dump. So in case I forget something during my video, I can just refer this paper. Oops, where did I put my pen? Sorry. Just put my pen here. Just getting my pen. Okay, thank you. Now I'll be starting the video. I sanitize my hands again. I'll start with the medical history. Do you have any chronic health condition?
No.
No. When was the last time you have done your wellness checkup?
Last year.
Okay. When was your last dental visit?
3 months ago.
When was your last vision? When is eye checkup?
That was a year ago too.
Okay. Did they find any abnormalities on your checkup? No. So, do you have any chronic illness or any infectious disease like HIV, AIDS, hepatitis, anything? Do you have any allergy to any medication, food, or environment? No. Okay. So he does not have any allergy to any medication, food, or environment. In case if he does have an allergy, we will determine the severity of the allergy, what he is allergic to, and the reaction for this. Do you take any of the medication? Okay, so he does not take any medication. So if a patient is taking medication, again we will ask for like dose of the medication, frequency of the medication, why they are taking the medication for, and is the medication being effective. Medication history. Let's see. Do you have any psychiatric history or a mental illness?
No.
Okay, thank you. And for your sexual history, are you sexually active?
Yes.
With like male or female partner?
No.
Okay. Do you use anything for a family planning?
No.
Do you have babies?
I do.
How many?
2.
Okay. Thank you. So, have you done your sexually transmitted disease check? Like, when was your last STD test?
Last year.
Okay, was it normal? Anything? Did they find anything?
No.
Okay, thank you. And then for the male gynecological history, we will ask for the self-testicular examination, TSE. So do you usually do like every month your self-testicular exam?
Yes.
Okay, so for the testicular exam, we will encourage the patient to do it in the shower with the soapy hands. Just feel the balls with their fingers, and if they note any lumps or bumps, any lumps or lymph nodes, then notify the physician. And for the female, we will ask for the last menstrual period and breast self-examination. Again, do it in the shower with the soapy hands. We encourage to do on like same time or same day of the month every month, and just palpate the breast, like feel any lump or node, any lymph nodes noted on the breast. Just notify the physician for that one too. And for the female patient, if they are pregnant, we'll ask like how many months of pregnancy they are, do they already have a baby, and how is the pregnancy going, or is there any complication on the pregnancy. For your vaccination, are you up to date with your child immunization vaccines?
Yes.
Are you up to date with your flu and COVID SARS?
Yes.
Okay, thank you. And for the male patient, both male and female, we educate about the breast self-examination for them, and then if they find any abnormalities, just reach out to the doctor. And now I'll be moving to the family history. For the family history, is your both mom, like parents alive?
Yes.
Okay. And do they have any medical history?
No.
Okay. Is your maternal grandfather alive or?
No.
Okay. Does your maternal grandmother is alive?
No.
What about your paternal grandfather? Is he alive? No. Paternal grandmother? No. Do you have any brother or sister?
I have one brother.
Okay. Do they have any medical history?
No.
Okay. Now I'll be telling about the system wise. I'll be going to the system wise for the family history, and let me know if any of your family has any of this history. Okay. For your HENT, does any of your family has like glaucoma, hearing deficit, otitis media, sore throat, anything?
No.
Okay, does any of your family has, like any of your family member or siblings has like cardiovascular, like stroke, or coronary artery disease or anything?
No.
Okay, does any of your family member has a respiratory disease like pulmonary embolism, pneumonia, anything? Does any of your family member has a neurological disorder like a stroke, migraine, anything?
No.
Does any of your family member has GI issues like GERD, diverticulitis or anything? Does any of your family member have GU like BPH or endometriosis? Any of those history? Does any of the family has a history of obesity?
No.
Does any of the family has a history of hematological or lymphoid like bleeding disorder, anemia?
No.
Does any of your family has like a history of substance abuse, alcohol drinking or illicit drug use? No. Okay. Does any of your family member has any of the allergy to environment or food, environment and the medication? Does any of your family member has a psychiatric history, anxiety, depression, bipolar disorder or any of those? Okay. Is anything? No. Okay. Does any of your family member has a musculoskeletal history like osteoarthritis, osteoporosis, joint disorder? Okay. Now we will move towards your social history. For the social history, what is your race and ethnicity?
I am Indian Asian.
Okay. Are you married?
Yes.
So do you have kids?
I have kids.
Okay. Then for the social history, do you drink coffee?
No.
Do you drink alcohol?
No.
Do you use tobacco?
Nope.
Do you do any illicit drugs?
Nope.
How many ounces of water do you think you drink a day?
Ounces, I'd say.
Glasses.
Glasses, about I think 6.
Okay.
6 glasses.
Okay. And how about your sleeping pattern? Do you think are you sleeping fine?
I think I sleep fine.
Okay. How many hours a day are you sleeping?
I want to say 6 to 8.
Okay. What is your occupation? What do you do for a living?
I have my own business. I work from home.
Okay. Have you ever served in military?
No.
Okay. So you said you have your own business. Do you live in a house?
Yes.
Is it 2-story?
Yes.
For the safety thing, do you have safety stairs like rails or sidings on the stairs?
Yes.
Okay. Do you drive?
Yes.
Do you have when you drive, do you wear a seatbelt?
Yes.
Any history of drink and drive? Okay. Did you come to the clinic by yourself or anybody?
I came by myself.
You came by yourself. Okay. Thank you. And have you ever faced the domestic violence or a physical abuse in the house?
Never.
Okay. Do you have any hobbies and what are they? If you have.
To play basketball, football, spend time with family.
Okay. Let me see if I missed anything. What kind of diet do you use?
Diet?
Like regular diet and
Yeah, I'd say regular diet.
you follow any other specific diet?
No, just regular diet.
Okay. Do you exercise?
Yes, when I
How often do you exercise?
maybe once or twice a week.
Okay, sounds good. And we went to that one, and then now we are going to do the review of system for you. We did for the family, but now we are doing for the family. Does any of your kids or wife has any medical problem? No. Okay, so now we are doing for yourself. Okay. So do you have any? We are starting with the head, eyes. Do you have any blurred vision or hard time seeing? Any hearing, conjunctivitis, anything? Do you feel sore throat? Any enlargement in the throat, difficulty swallowing, anything? For your nose, do you have any nasal discharge or nasal irritation? For your ear, do you have any hearing deficit or anything? Okay. For the cardiovascular, do you have any chest pain or having hard time breathing? For the respiratory, any difficulty breathing? For the GI, any stomach upset, diarrhea or constipation? For the GU, genitourinary, do you have painful urination or having hard time urinating? For the endocrine, do you have have a diabetes or like hypothyroidism? I think I missed on the for the family. Does any of your family has a history of diabetes or hypothyroidism? No. Okay. For the musculoskeletal, do you have any painful joints or swollen joints anywhere?
No.
Do you feel pain on the joints?
Nope.
Okay. For your mental health, do you have any mental health issue? Anxious, depressed, stressed, anything?
No.
Okay. And miss anything over here? For your neurological, do you feel any headache, stroke-like symptoms? Anything? No. For your allergic, are you allergic to any of the medication environment or the food? Okay. And for the when you get a hurt or something for immunological, does it take a long time for you to heal, or do you heal pretty quick? Okay. And for your allergic or skin or breast, like do you have any rashes, lesion, or anything on your skin? Okay. Does I think for the family, does your no, I asked that one. Sorry, that's fine. GIGU, I did Indo. Okay, and we are now done with the review of systems. Now we will be doing the physical examination on you. So for the physical examination, now I will not be performing. I'll just be verbalizing. For your blood pressure, I'll be doing both the hands, and your right hand is 120 by 80, left hand is 132 by 80. So I will just combine both of two and get the medium one. For your heart rate, the pulse is 78, respiration is 18, SpO2 is 98 on the room air. Now what is your height?
5'11".
What's your weight?
230.
Okay, and so with your height and weight, the BMI is 33, which is little above the normal, like on the obese side. So we need that one, and then so now I'll be moving to the head, eyes, ear, and nose, like actually ENT system. So for that, I will be doing the inspection. I sanitize my hands before I touch you. Is it okay if I touch you while I do the examination? Thank you. So for the inspection, I'm seeing no lice, no lesion, no redness. Here is evenly distributed. Black here, no alopecia noted. Like in the front, I can see a little bit of thinning here, but not any alopecia patches over there. And no papules, no lesions, nothing on the skin. And for your now I'll go with the eyes. So when I'm doing with the eyes, I'll cover up the cranial nerve. When I'm doing your face, I'll do both, like inspection or the examination, plus I'll cover up the I'll cover up the cranial nerves too. So for the eyes, I will see the sclera, normal, no excessive drainage like lacrimal ducts presence, no lesion, no rashes, no dilated blood vessels in the eyes. This is a cranial number 2, optic nerve. So for this, for the vision test, I will be just using the Snellen chart, which I'll be standing 6 feet from the patient and just like, can you cover your one eye and study? Like, till the third eye.
GLCT.
Okay, cover your another eyes and do the same thing for me, please.
GLCT.
Okay, and open up your both eyes and do that for me, please. The same, third line.
GLCT.
Thank you. So for the visual exam, we usually dim the light. I'm not doing it over here, but I'm just verbalizing, like we have to do the dim light. So now I am seeing with the pen light, I'm seeing the pupil reaction. I'll be doing direct and indirect. So again, we have to dim the light. I'm not dimming over here. People reactive to the light, both direct and indirect. Now I'm doing the ophthalmoscopic exam over there. Yeah. So for that, I'll be using my hands for the safety purpose over here, and then I'll be doing right to right and left to left. So for the right, I'll be like looking over here. Left, I'll do the same thing, left to left, and using my finger for the safety. I can see the red reflex, no dilated veins, arteries or veins. The cup to disc ratio is 1 to 3. In the eyes, no woolen spot. Eyes are normal. So, and I'll be doing the confrontation accommodation. Just follow the finger. Okay. Now I will be doing the another 3 cranial nerves for the eyes, which is cranial number 3, 4 and 6, oculomotor, trochlear and abducens. For the oculomotor, just follow my finger, okay? Okay, so while he was doing that, I saw he has no exophthalmos, no nystagmus, no ptosis, and he was able to follow me like up and down and the sidewise, which is a normal finding. For the cranial number 4, just follow my finger again. I will be going lateral and downward, which he was able to follow me. And for the cranial number 6, which is abducens, which is horizontal, just follow me one more time. Thank you. So all 3 cranial numbers were fine, like normal. He was able to follow with the thing. And now I'll be doing the confrontation. Let me know if you see when you see. Oh, okay. For that one, cover your one eyes. Let me know when you see my hand.
Yep. I see.
Okay, you know how to cover the other eyes. Let me know.
I see.
Okay. Open the both eyes.
See.
Okay. Thank you. And so now I'm gonna move into the nose. For the nose, I did not see like nose is cranial number 2, which is olfactory. For the olfactory, you're gonna I see the nose doesn't have any races, no nasal deviation. So I'm gonna see inside for the mucus, hair present, no nasal discharge. The mucosal line is pink. So for this one, I'm gonna tell the patient to close his eyes and differentiate the smell. So can you close your eyes? Can you close one of the layers and tell which smell is this? Okay.
Coffee.
Okay. Can you cover the other layers and tell me which smell is this?
Cinnamon.
Okay, thank you. Go ahead and open your eyes. He was able to tell the smell like both of them. So another one is the ear. For the ear, I'm gonna do the hearing test first, or I'm gonna do the inspection first. For the inspection, I can see no nasal discharge, no rashes, nothing. And for the hearing test, I'm gonna go ahead and do the waiver test first. For the waiver test, I'm gonna put a tuning fork on your head. Let me know once you stop hearing, or you can hear both equally on both sides.
I hear you.
Okay. And then for the next one is the Rene test. For this, I'm gonna put the tuning fork on the back of his ear. Let me know. What's he hearing? Stop hearing.
Stop.
Okay. And again.
Stop.
Okay. So that means ear conduction is more than the bone conduction. So even after I stop from the bone, he was still hearing on the ear. Now I'm gonna go ahead and do the otoscopic on his ear. Put the thing here. Okay, so for this one, I'm gonna see here the hair present, no ear wax. I can see the pearl gray tympani membrane, and right side is 5 o'clock, the cone. And I'm gonna do the same thing on the second ear. Pearl gray ear, no yearly discharge, and cone of light is in 7 o'clock. Okay, I'm gonna. Okay, so for the cranial number 5 is a trigeminal nerve. So for the trigeminal nerve, I'm gonna test his jaw. I'm gonna palpate the TMJ. Let me know if it is painful. Open your eyes. Open your mouth. Sorry. Okay, is it painful?
No.
Okay, so while I'm touching it, it is not painful, which is normal. Now I'm gonna go ahead and do the forehead cheek and TMJ, dull and sharp point. Can you close your eyes? And let me know if it is dull or sharp.
That's not sure. No. No. Sharp. No. Sharp.
Okay. Thank you. So that was cranial number 5, we already covered the 6. For the 7 cranial number in the face, no rashes, no rashes, no sensitive, no lesion, no scar, anything. So can you smile? Raise your eyebrows and just okay, he was able to follow all of those. Cranial number 8 is abducens, which I already did the hair. Sorry, not hair. And for the cranial number 9, we're gonna do the tongue. Open your mouth. The tonsil is in +2. Open. Can you take the tongue out? Okay, he was able to take the tongue out. No, David. Tongue is midline segmented. Uvula present. Mucosa. Let me see inside the mouth. So pink mucosa, pink tongue, no dental caries, no dental cavities. And for the cranial number 10 is the vagus, which is gag reflex. I'm not gonna make him gag, but it's like take a stick, put it in his tongue, and make him feel gag. Cranial number 11 is spinal accessory muscle. For that, we're gonna visualize the shoulder with the shoulder, and there is no rashes again. No, it's just not touch. Any pain or tenderness? No. Okay, can you strong your shoulder up? Don't let me push down. Okay, can you see the other, this side, left side? Don't let me push you. And the other side, don't let me push. Okay, don't let me push it. Okay, thank you. That's the cranial number 11 and the shoulder. And for the cranial number 12 is hypoglossal, which means like the tongue, strength of the tongue. So can you just push your tongue with the, push your cheek with the tongue? Other side. Okay. That was covered all cranial nerves. So now I'm gonna go ahead and do the neck. For the neck, I'm gonna see the tangential view. Just swallow it. Okay, he was able to swallow. No lymph node. Did you have any difficulty swallowing? No. Okay, so I'm gonna go ahead and feel the lymph nodes over here. No lumps, no lymph node noted, and I can feel the thyroid cartilage, cricoid cartilage, and the trachea over there. And I'm gonna go ahead and feel the lymph nodes for his preauricular. Let me know if you have any pain or tenderness, okay? Preauricular, postauricular, any pain or tenderness? Submandibular, submental, occipital, and then anterior cervical, posterior cervical, and supraclavicular over there, and post and supra, yeah. Okay, so we are done with the neck, lymph nodes, we cover all the face. Now we are, let me see something, cover, skin, scars. For the skin, I said there is no macule, no papule, no vesicle or no pustule. And then for the head and neck, the one thing left is the sinuses. For the sinuses, we're gonna do the frontal sinuses on the forehead and the maxillary palpate the maxillary sinuses. Any pain or tenderness while palpating? No. Okay. So we did all those, and for the perla reactive to light, and now I am gonna go ahead and do the lungs. So for your lungs and lungs, chest, and abdominal, would you mind taking off your sword, please? And I want you to take off your, yeah, just take it off. Okay, thank you. Put it over there. So for the lungs, I'm gonna just see the chest deformities, no chest deformities. Okay, stand straight. Anterior to posterior is 1 to 2, no scars, no exudation or carnation, like that means no bumping, like not perforation chest or anything. So I'm gonna do, after that, the respiratory rate, normal respiratory rate. He is not having any hard time breathing or not like for a breathing problem. So for the respiratory, I would like to do the back posterior first. Can you just sit over there facing your back towards the camera?
Like this?
Yeah. Okay. So little more. Yes. Okay.
This?
Little more. Like yeah. Okay. And bend little forward.
Like this?
Yeah. Thank you. So we can see from the camera. So I will be doing the tactile premises. For the tactile premises, I'll be putting my hands on the long field with the edge of my palm, and then just say 99 whenever I feel my hand over there, okay? So 99.
And 99. 99.
thank you. And I can hear the vibration both equally on the same side, which is normal finding. And then now I'm gonna do respiratory exertion. For the respiratory exertion, I'm gonna put my thumb like a whole finger with the thumbs on the T10 of the spine. And can you go ahead and take a deep breath and exhale it? Okay. So while he was exhaling, I can see my thumb separating, which is a normal finding. And now I'm gonna go ahead and do a diaphragmatic exertion. So for that, I'll be comparing both sides, but now I'm just be doing one side, and then we can compare the other side. So for the diaphragmatic exertion, just go ahead, take a deep breath and hold it. Okay, so I'm gonna percuss the line and find the dull place and mark it over here, and then from here I'll go up and then, okay, now go ahead, and that was for the inhalation. Now go ahead and exhale and hold it. Okay, now I'm gonna go up from here. Okay, so this is the point. I'll mark these 2 points and I'll just measure it with the ruler I have. And this is 7 centimeters. The normal is 6 to 12. And I will go ahead and, like, usually we do both the side, but over here I'm just doing one side. So we did percussion and now deep tactile. Okay, I did 3. Now I need the percussion. So for the percussion, I'll be percussing all 12 long fields, both, and then compare, and then see. Okay, I can feel the resonance. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 14. Okay, I can feel the resonant sound while percussing. Now on the same long fields, I'm gonna go ahead and do the auscultation with my step. Take a deep breath. Okay, just relax now. I'm gonna go ahead and do with both bell and diaphragm. Okay, thank you. So I did not hear any ronchi, whizzing or crackles while I do the long sound. Okay, go ahead and turn to the camera, please. Thank you. So now I'll be doing the same thing like all those in the anterior chest. For the I'll be doing the tactile parameters first. Let me sanitize again. Sorry. So for the tactile parameters, just go ahead and say 99 every time I do.
99, 99, 99, 99, 99.
Thank you. So equally vibrating on both the sides. I'm doing the percussion on the same long fields. I'm comparing both the sides, which is like usually 12 to 14 lungs field. Okay, I did not feel any fluid filled with air, which is resonant, which is tympanic, not resonant. Okay, I'm gonna go ahead and auscultate the same fields with my stethoscope with both bell and diaphragm. Okay, I'm gonna go ahead and do the same thing with the bell. Thank you. I did not hear any whizzing crackers or anything, which is a normal finding. Now I'm gonna go ahead and do the cardiovascular. Anything? Yes. For the cardiovascular, I will be doing hearing the chest sound on the all 5 space. The first one is aortic, right second intercostal border, pulmonic, left second intercostal border, arch point, third sternum border, tricuspid, left sternum, fourth intercostal, left sternum border, and a mitral fifth intercostal, left sternal bottom. I'll be using the bell for the same thing. I can hear the S1 and S2 sound. I did not hear any S3 or S4 or any other abnormal sound over there. And then, so for the heart sound, I'll be doing both sitting and lying. So can you go ahead and lie over there? Just taking sit. I'm gonna put the pillow. Okay, go ahead and lie down. I'm gonna put the pillow in the head, and I'm gonna put the pillow under his leg because I'll be doing the abdominal video while abdominal exam while he's doing over here. So I'll be hearing the same heart sound while he's sleeping. The alto, aortic, pulmonary, arch point, tricuspid, and mitral with both bell and diaphragm. And I will also hear the aortic apex of the heart, which is the fifth intercostal border, mid-sternum. And now while he's lying down, I'm gonna do the arteries, which is carotid arteries, renal, femoral, iliac, and aortic artery. So for the aortic artery, I'll be doing 2 cm above the umbilicus. I'll be doing with both bell and diaphragm. Nostrils, renal arteries, iliac arteries, and then the femoral artery. For the femoral artery, I'll just be doing on top of the clothes. I'm not gonna remove the clothes. I'll be doing all of these with both bell and the diaphragm. No thrill hurt like normal. And then I'm gonna go ahead and do the carotid arteries one by one. For the carotid artery, the head of the bed should be elevated 30 to 45 degrees. And I'll be doing one by one with both bell and diaphragm. Thank you. And while he's lying down, can you turn your head toward the other side? I just want to see the jugular vein distension. I'm not measuring the jugular vein distension. I'm just seeing the jugular vein over there. Looks normal. So for the heart, I think that is it. If I have not ruined any of those arteries, yep. So I'm gonna go ahead and do the abdomen over here. For the abdomen, I'm just gonna do the inspection. For the inspection, no hernia noted, no discoloration. For the discoloration, I'll be looking for the jaundice, and if I see any discoloration in the abdomen, I will go ahead and do the sclera over here on the top. So I'll try to figure out the differentiate between the abdomen and the sclera, and then both of them are not discolored, which is a normal finding. Now I'm gonna go ahead and hear the bowel movement or bowel sounds. So I'll start with right lower quadrant, right upper, left lower, left upper. No hyperactive or hyperactive bowel sound heard. We have to hear it for like a full minute to find out if they have any hyperactive or hyperactive. Now I'm gonna go ahead and do the palpation over there. First I'll do the percussion. So I'll do the percussion of all 4 quadrants. So for the percussion, I did not like it's fluid filled tympanic, no resonance, like a dull sound. And then I'll be percussing the liver over here and see if I can. Yeah, I can hear the dull sound for the liver. I could not, like on the spleen, I'm percussing the spleen, and I can do the liver. For the liver span, so for percussing the liver span, I'll be percussing from the top and find the dull in between the rib cage, and then I'll come down from the like umbilical line and start going up and percuss or tap it until I found the dull spot. So I measure this 2 dull spot, which is 4 centimeters. The normal, which I have to measure those. So in between these 2, what I'm measuring is 4, and the normal is 3 to 5 for him. So I am gonna go ahead and do the palpation. For the palpation, I will do light and with the light and deep palpation. For the light, I'll just be using one hand. Let me know if you have any pain or tenderness. Okay. So no, I did not found any hernia while palpating. No lumps, no lymph nodes, no lumps. And for the deep palpation, I'll be using both the hands. I will try to palpate the liver. I could not palpate it, which is a normal finding. That means no enlargement of the liver. Again, I'll try to find any enlargement of the spleen by deep palpating. Let me know if I hurt you. I can always stop if I hurt you. No palpation. And I cannot palpate the spleen either. So now I try to find the edge of the liver, which is below the diaphragm on the apex of the corner over there, and over here is the where I can feel the liver over there. Okay, so that was all for the abdomen. Let me see if I okay, so you can go ahead and sit up. Oh, for 1 second. For the femoral artery, I'll just try to find the lymph nodes, any lymph or something in the femoral artery is nothing. Okay, go ahead and sit up. You can also stand. Now I'll be doing the spine. For the spine, if you can turn back. Here. For the inspection, look straight, no deviation of the spine, and I'll be palpating, like for the, while inspecting, no redness, no rashes, no scars, look, no open wounds or anything. And I'm palpating the back. Let me know if I hurt you anywhere.
No pain.
No pain. Okay, so while palpating the spine, no pain or no tenderness. While he's standing, I would like to do the CBA tenderness. So for the CBA tenderness, I'll just put my palm over there and just tap it over there. Let me know if you have any pain or tenderness, okay? Any pain or tenderness. No pain or tenderness, which is negative for CBA tenderness. And okay, can you lie down for a second? I need to palpate your kidneys and bladder. Sorry, I forget that.
How about that?
Yeah, I am back. So I'm palpating the kidneys, not palpable, and for the bladder, not palpable. For purposing the bladder is dull, which means he has a full bladder. And for kidney, I can feel the dull sound over there. Okay, and I think that is it for that one. Okay, go ahead and stand up, please. I'm turning back over this side. Okay, so I already did the inspection for the spine, I did the palpation for the spine, and then now we are doing I didn't see any sclerosis, any lymphosis, or any kyphosis. So for now we are doing the range of motion. So the range of motion, we are starting with thoracic. So for thoracic, can you just bend down, like bend towards down, touch it over. Bend it, okay, flexion, just go back and bend toward back, extension, okay, and then left lateral, this side, and the right lateral. Okay, he was able to bend all the side. Go ahead and sit over there. So we'll do the cervical one. So for the cervical or for the neck, I want you to bend your head down, head up, that's flexion, extension up, okay, right lateral, left lateral, and then rotation, rotate your neck. So he was able to rotate his neck, normal. Let me see if I miss anything on there. I did not miss anything over there. Now I am going and doing the upper extremities. So for the upper extremities, I want to go with the feelings first, like a dull or a sharp. So for that, can you close your eyes and let me know if the sharp, for the sensation, if it is dull or sharp, okay?
Sure. Do. Sure.
Okay, thank you. Now I'm gonna go ahead and do the inspection for the fingers. Let me see your fingers. Okay, so no swelling of the fingers, no rashes. For your nails, capillary refill within 3 seconds, no curving, no tired staining, no sinuses. So now I'm gonna go ahead and do the palpation. I'm gonna touch your finger, the metaphalanges fingers. No swelling of the joints noted, no swelling of the fingers noted. Anything with the fingers. Okay, and then for the range of the motion for the finger, just abduction, sorry, this is abduction and adduction. Flexion, down, extension. Okay, so you were able to do that, and then now I'm gonna go make a fist, like strong fist. Okay, and then just do this, and don't let me to close it. Okay, and then close it. Okay, perfect. Thank you. And now I'm gonna go ahead and do the wrist. For the wrist, the same thing, inspection, nothing on the wrist. I'm palpating the here medial ulnar radial pulse, radial lymph node. On your right here, the thumb, no lymph nodes noted, nothing. For the radial range of motion, we're gonna do flexion. Just flex it down, extension, up. Okay, and then adduction. Watch yourself, like this. And abduction, just the finger, like just adduction and abduction. Okay, for the wrist, like don't let me push you up. Okay, don't let me pull you up. Okay, thank you. And then for your elbow, I'm gonna do like tennis elbow, and for the elbow, like flexion. Let's just do start with the flexion, extension. Okay, supination and pronation. Okay. So I didn't see any rashes, anything while palpating, no lymph node and nothing for the elbow. And next for the shoulder, no rashes, no normal, no deformities, no joint swelling or nothing. While palpating, any pain or tenderness? No. Okay. So for the shoulder flexion and extension, for the flexion, bends towards like hold yourself, bending. Okay, the extension is just extend your like this. Okay, and for the rotation, just this, like lateral and left. Okay, he was able to do that, and we're gonna repeat one more time the struggle stays, like strong your shoulder up, and don't let me push down. Okay, thank you. And that was for the shoulder, upper extremities. Let me see if I forget everything. Ankle and thoracic, inspection elbow, wrist, hand, wrist, and did axillary and epitrochlear. So for the palpation, I'm gonna go ahead and just lift your arm up. I'm gonna do the axillary lymph node palpation. So no lump, nothing, and I'm gonna do epitrochlear, which is the inside of the arm. No lymph node or nothing noted over there. Now put your hand up. Now I'm gonna check the reflex, deep tendon reflex. So for the reflexes, I'm gonna do the up first. I'm gonna do the tricep one here. Okay, I'm gonna do the biceps, and I'm gonna do the okay. So positive reflex, like positive reflex present, all reflex present over there. And for your arms strength, just do like a flexion. Don't let me push you, don't let me pull you. Okay, that's all for that one. Now I'm gonna go ahead and inspect your lower extremities. For the lower extremities, for the inspection, for your knees, ankle and feet, no rashes, no deformities, no joint swelling noted or anything. For the palpation, your popliteal here, your ankle, Achilles, and your feet. No lymph noted, no lymph node found, no swelling, no deformities and any pain or tenderness while I am doing no. Okay, so for your range of the motion, for your knees, maybe you just want to lie down one more time.
On my back?
On your back, yes please. Okay, for the, can you lift up your leg? Like for the extension, just straight, and for the flexion, just bring your feet down over here. Okay, while you were doing that, don't let me push you in. Okay, and don't let me pull you back. Okay, thank you. And then that was the flexion and extension. For rotation, that is abduction. Lift your leg. Okay, that is adduction and that is abduction. Okay, just the knees like adduction, abduction. Okay, that was for the knees. I need to do the reflex. So before I do the reflex over here, while he's already lying down, I'm gonna do his hip. So for the hip, I'm gonna take off his clothes. So no rashes, no lymph nodes, no bumps, no bump, no swelling, nothing noted. Let me know while I'm palpating any, for the palpation, any deformities, no deformities, no lymph node notice, no swollen joint noted, any pain or tenderness. No. Okay, so for your hip rotation, so for rotating like for flexion, lift up your leg and just do totally back that side, like, okay, put this leg straight, okay, and then for extension, just do this side, the same thing with the this is also like abduction and adduction, adduction, abduction. Okay, and for your lift up your leg, and while you're doing the other side adduction, for your strength, don't let me push you towards there, and for this side, don't let me push you back there. Okay, sounds good. Thank you. You can go ahead and sit over here. Sit a little back so I can explain. Sit over there. Now I'm taking his finger for the capillary refills. The capillary refill, when I press, they are less than 3 seconds. No cyanosis, no clubbing, no tarn staining. Finger looks fine. And then now I'm gonna go ahead and do the reflexes for the lower legs. Use the hands again. So for the lower leg reflex, I'm gonna go ahead and do the popliteal one over here. Lift up your leg. Okay, and I'm gonna go ahead and do the Achilles over here. Okay, and I'm gonna go ahead and do the balance ski reflex here. So with the finger. Okay, I can do the balance ski over there. So those are about the reflex, wrist, determine, long perla, I think that is it, and the one for the, now I'm going to go ahead and do 1 point and 2 point, okay, and the dollar beat. So close your eyes. For your upper extremity, let me know if it is 1 or 2.
1, 1, 2.
Okay.
1.
Okay, so now let me know if it is a dull or a sharp, okay?
Dull, sharp, sharp, dull.
Okay, same thing with the lower extremity. Close your eyes and let me know if it is 1 or 2, and then dull or sharp. First 1 or 2.
1, 1, 1, 1, 2, 2, 1.
Let me know if it is sharp or dull, okay?
Sharp, dull, dull, sharp, dull, dull, sharp.
Okay, so he can feel the pain, 1 point and 2 point discrimination, and sharp and dull. So the last one that is remaining is his gait, where his consciousness is alert and oriented times 4. His conscious is being able to answer all the questions fine. So let's test your gait. Would you mind standing up for a second, please? Okay. So for the balance gait, his standing balance, just walk. Can you walk straight? Okay, come back on your toes. Come back just on your toes.
Come back on my toe.
Yeah, just walk with your toes. Okay, and walk with your heels. Okay, and then for the Romberg test, I'm gonna do the Romberg test for his balance test. Close your eyes and just put your hands up, like, don't let it fall. And I'll catch you if you fall. Okay, and don't let me pull my, don't let me do that. Okay. So when I did that, it came back normal up. See the timing? Okay, go ahead and sit down over there. Now I will see if I have forget anything, so I can tell it on the last. Everything should looks good at this point. I don't think I miss anything. So on today's videos, like, I did not find any abnormalities other than weight being a little high, which we can work on the diet and exercise. Other than that, everything, all the assessment came back positive, like no negative finding or no abnormal finding. Okay, thank you so much, Vishal, for letting me to do the video. Everything seems positive, nothing to worry about, and it's all good. Thank you so much.